Do athletes have asthma?
It's very common. It's very common for athletes to have asthma. I think the most fascinating thing about athletes and asthma, there have been some studies showing that some athletes, especially track and field athletes that have asthma, might very well outperform the ones that don't have asthma. We don't know why.
Why that is.
It's a fascinating aspect of asthma.
Can exercise bring on an asthma episode?
Sure, it's very common for it to do that, especially if you're already suffering from ongoing asthma. So I have a lot of my patients that tell me they only have trouble when they have asthma, but when we check them, sometimes they have low baseline lung scores. It's just sort of tipping them over the edge, so to speak. So it's a good clue, but all patients with asthma, if they're not being treated, they'll have trouble when they exercise in cold air. And that's when I ask the patients, do you have trouble with exercise? I always ask them a second question. Does it happen more with cold air? And I always get an exaggerated answer to, oh yes, cold air is much worse.
Cold, dry air just
Yes.
seems to make asthma come on in somebody that's prone to get that. Is there treatment for that?
Absolutely.
Well, what do you tell patients to do with that?
It's easily treated, a very high success rate. 95 to 97% of them will have no symptoms of asthma if they'll do their rescue inhaler, their short-acting bronchodilator before they exercise. The book says 15 to 30 minutes before they exercise, but personally, I'm always waiting till the last minute. I don't remember it till I'm out ready to run, and as long as I use that inhaler, I never have a problem.
What's the name of that inhaler?
Albuterol is the most common. Then you have Zopanex as well too, which is a modified albuterol. Those are the only two rescue ones available. There's some long-acting inhalers that also work, but they might take longer to kick in, so you might have to use them an hour or so before. I'll use those sometimes in children when I want to make sure they're covered all the way through school so they don't get to school and miss their inhaler. So we might give them a longer acting medicine, longer acting inhaler, and or we might give them something like single air or an oral bronchodilator that will last longer, so no matter how much exercise they do when they're away from their parents, it's still going to work.
So if somebody uses albuterol, how quickly does it begin to work? And how long does it last?
In seconds, and it'll last for about 4 hours.
So,
but it always works better if you take it before you exercise.
If somebody gets out to where they're going to run, oh, I forgot my inhaler, is there anything that they could do to get from getting exercise-induced asthma?
There are some warm-up exercises and keep a steady pace for a short period of time. Personally, with myself, I haven't found it to be effective. And when I've looked at the studies, it works 40–50% of the time. I tell them if they forget it, just go back in and get their inhaler. And some of them, I learned when I was really young, if I could put something in front of my face that could help heat the air, scarf or something like that when I didn't have my inhaler. I was young enough that they only had Primatene Mist, and it was so uncomfortable to use that I just went real slow when I was outdoors and cold.